Good afternoon, everybody. And we really thank Gideon Mann and Bloomberg for inviting us here to talk about creating data-driven knowledge in communities of need. My name's Catherine Kramer, and although my tag says I'm from Carnegie Mellon University, maybe my avatar is at Carnegie Mellon, I actually am from the New York Hall of Science out in Corona, Queens. Just curious, a show of hands, who here's been to the New York Hall of Science? Good, yay, good, excellent. Well, if you grow up in New York, most kids who go to public school here do cross our threshold one way or another. And if you haven't been there, we invite you to be there. We've been there, we were built in 1964 for the World's Fair. And we have been engaging about 500,000 visitors a year in active hands-on learning, what we call design, make, play, ever since. And what brings us here, me here, to this panel, is in recent years we've been doing a lot of work under the general heading of complexity, and that includes network science, big data, systems, and most recently, smart and connected cities and smart and connected communities. And through this work, I have gotten to work with all of these panelists, and we have become quite interested in, concerned about, and focused on what we see and what a lot of you, of course, see, because that's why we're here today at Data for Good Exchange, this gap between the tools and technology development and the needs of underserved communities, and what needs to be done in order to identify those gaps and to address them. I am now going to turn over to the panelists and ask you all if you could introduce yourselves, talk a little bit about what communities you work with specifically, how data figures into that work, maybe some challenges you see, and what might be done in order to bring those two sides togetger.
Sure, should
Clayton.
I pick it up? Okay.
Sure.
Hi, everyone. My name is Clayton Hunter. I work at NYU at the Center for Urban Science and Progress. I'm on what we call the data facility team, and so most of the team supports analytic work with researchers at the university. I'm working on a project and have been for the last year that's a little bit different. We're working with all levels of government to try to help them use their data better to serve whatever communities they serve. So who we're working with specifically are people that work at agencies or want to learn how to do data analytics within their own lives, basically. So the way we do that is we have a applied data analytics training program. We've run through 2 different cohorts of people. We're going to start the next group in 2 weeks, actually. And there's been just over 100 government employees from 40 different agencies, all different levels. So many from city and county, but also from state and federal level. And the whole training program is, how do we answer whatever questions we have with data? What kind of actual products can we create to help improve whatever our agency is doing? So the first class was mainly centered around corrections data. And we had all of the admissions and exits data from the state of Illinois, as well as wage records, so we could look directly at what kind of an impact getting a job has on somebody's rates of recidivism, on people's recidivism, right? Whether they go back to prison or not. The second group was around welfare benefits data, similar type of a thing. Once you go off welfare, what increases your probability of going back onto welfare? And so all of this work is sort of being pushed forward by the Census Bureau and the Commission for Evidence-Based Policymaking. So just like we're talking about here, how to use data to improve policy decisions. And there's a bunch more pieces about that, but I'll pass it off to the next person for the next intro.
Sure. Good afternoon, everybody. My name is Carl Anthony Finney. I'm the founding principal of the International High School for Health Sciences. It's a public high school located in the Elmhurst Corona neighborhood, within walking distance of the Hall of Science. Our high school is a New York City public high school that serves recently immigrated English language learners. To be a student in our school, you have to have immigrated to the United States within the last 4 years and be a second speaker of English, so speak another language at home. The community that we serve is pulled from about 30 different nationalities among the 300 students that we have, and speak about 20 different languages at home. Approximately 60% of our students come from Spanish-speaking households. Our second largest group are Bengali students, but there's an incredible diversity among the remaining percentage of students that we work with. Our school is over 90% free and reduced lunch, so it's a high poverty school. So we're working with a population of students that have a lot of challenges and typically have struggled in other school settings to keep up with the graduation rates of their native-born peers. So our school focuses around providing services for that specific community of students. And so obviously data is one of the pieces that we need to focus on, not only to track the progress of our students, but also to help identify what practices teachers are implementing in the classroom that are having the most leverage with the students that we serve. One project that we undertook in the spring this past year in collaboration with the New York Hall of Science was a project called Mobile City Science. One of the issues that we know is often discussed is the gap between these data tools and communities of high need like the ones that we serve. And so one of the questions we were interested in was what opportunities exist to get students more involved in the conversation and using some of these tools to help make recommendations about improving their neighborhoods. It was a fairly open-ended project that involved community walks, interviewing people in the neighborhood, and it was something that we think was really fruitful and could inform the way that we design some of our curriculum to bring more of that kind of work into a project-based curriculum, particularly around our 12th grade U.S. government and participation courses. So we're really excited to be here and to be part of the conversation today.
Yeah, I can really just take off right from that. Yeah, my name is Parikh. I'm a professor at Cornell Tech on Roosevelt Island. I was previously a professor at the University of California at Berkeley. So yeah, as my prior panelist said, a lot of data tools are typically designed for larger, more well-resourced organizations that already have existing data or data streams that they can mine. So my research group has built a number of tools that support smaller organizations, community-based organizations, nonprofit organizations, and youth in collecting and using data for their own ends. Some of these projects include a company called Captricity that was started within my research group that was focused on extracting data from paper forms that was useful for health service delivery in places like sub-Saharan Africa and also in the United States. We were also involved in a project that used voice messages to collect and disseminate information to small farmers in rural India. That led to a company called Awaz Day that's currently based in India. We've also built open source tools for mobile phone-based data collection. This includes a tool called Open Data Kit, which is used by lots of organizations and governments around the world to do various kinds of survey-based data collection using smartphones. The most recent project, and probably the one I'm most excited about right now, is a project called Local Ground, which has a lot of synergy with the Mobile City Science project. This is a web-based mapping and data management tool that supports young people in creating their own data sets and using those data sets to understand and advocate for towards social change in their own communities and neighborhoods. Some of the things about Local Ground that are different than some existing data tools is that once again, it allows young people to not only leverage existing data sets, but to create their own data sets using their own observations, surveys, maps, and other forms of data. And other forms of data, I also mean not only quantitative and structured data, but also qualitative data. Qualitative data meaning pictures, audio interviews, hand-drawn maps, various kinds of social media streams. All of this data can be integrated in map-based visualizations and can be converted to various kinds of visualizations and narrative forms that can be used both for internal sense making and also to make presentations in things like town hall meetings or city hall or things like that. So yeah, I'm very excited to be here and to be with these panelists.
Thanks. Hi, everyone. I'm Amy Woolever. I'm a pediatrician at Elmhurst Hospital in Jackson Heights. Elmhurst is one of the New York City Health and Hospitals' main access centers in the borough of Queens, so it provides primary care, inpatient care, all kinds of services. And our population is obviously drawn from the neighborhoods of Elmhurst and Corona and Jackson Heights, and much like Anthony said, we serve predominantly an immigrant community. So our top 3 countries of origin are Mexico, Ecuador, and Bangladesh, but then the zip code of 11373 has people who come from 118 different countries, so a smattering of everything else mixed in. And this gives us tremendous ability to work with people who are new to this country, and in many ways just kind of getting a toehold on the ladder of living and working in the U.S. And from a healthcare perspective, there's kind of 2 different ways to look at data. There's, of course, the community-based health statistics and all kinds of kind of cumulative data we can look at, but then we can also look at our families' access to data for their own healthcare needs and for taking care of their children. And there's a huge disconnect in terms of things that might be available to help our families and what they can actually access. So, for example, our hospital converted over to a new electronic medical record about 1.5 years ago, which has a lot of capabilities for parents and families to interact directly with their doctors, to see their own lab results, to look at chart notes, to request refills for medications and things like that. But the most recent time that the administration has looked at the adult population to see, only 5% of our patients have actually accessed the electronic medical record through the patient portal. So it's something that's out there that could certainly be useful and helpful, but if your families can't access it, it's really not being very useful to them on a personal level. And in addition, I also am one of the assistant program directors of the residency program there, so we're training young doctors to be pediatricians, and as part of that role, I work directing the home visit program. So we go visit our families in the community. We actually go to their apartments and to their houses and get a chance to see what are the actual, what's the milieu that they're living in. So that's very useful to me to also get a real idea of what connected or not connected looks like on a family-by-family basis. So it's both thinking about data in terms of the big picture and in terms of the very micro picture of how it impacts each of our families.
So Amy, when we had spoken last week, you had mentioned also this question of access, right? That about cell phones versus computers, and if maybe you could speak to that as a particular issue with your population.
So very many of our families do not have computers at home, or certainly do not have internet access at home. It's much more common for the teenagers themselves or for the parents to have smartphones or cell phones, and I'm sure globally that's kind of where everybody is headed anyway. But I don't think that they tend to view that smartphone even as something that they could use for access. For example, they could, with Wi-Fi, be able to get onto our electronic EMR and do have some of the functionality of it. But it's something that would either have to be, kind of introduced to them, or they would need support to do it, or they would need to have Wi-Fi access, and all of that just kind of becomes a dead end for them in terms of being able to use the tools that they have. But I think very few of the families have home, internet, and computer full package.
And Anthony, you had, in that same conversation, you had also mentioned issues about that and how the high school was responding to access issues.
Yeah, so besides from just making sure that students have access to technology in the school, we've been working to expand the number of hours that the school is available to provide those services. So for the last several years, we've been running a 6-day school, so regular classes run Monday through Friday. but we've typically been open another 4 or 5 hours on Saturday, and then starting at 7:30 in the morning until 5 or 6 o'clock at night. So the idea is to expand the footprint of the day that's available to students, partly out of a need to address this issue of access that students have outside of school hours. If you're asking students to do a research paper, or if they're doing a science experiment, they really need to be able to have access to the materials that they need to do that work. And you know, having a student type out a research paper on a telephone is really not something that we want them to try to do, but they have tried to do that before. And then just trying to use opportunities to make technology available to students outside of the school. Queens Library has some programs that we've connected students to, and certainly there's the opportunity of depreciated technologies that either we've received as donations from, you know, corporate partners, or things that the school has, you know, rendered obsolete, but which is still functional enough for a student to take home. You know, we have also set up sign-out programs as well. So it's certainly one of the things that we're mindful of, and I think that's part of the issue of having a staff that kind of has that cultural competence and experience working with this population of students, of not coming in with the presumption that they're going to have the kinds of resources that you know, maybe the teachers might have in their own homes.
And there's also the issue of security and privacy, right? Data security and privacy, which for Anthony and Amy, I'm picking on the two of you, sorry, just a little bit longer, just because of you're working directly with these populations, and I know you know full well about these specific gaps or issues, challenges that need to be addressed. And data and security and privacy, right, for both of you, is something you deal with constantly.
Yeah, I mean, one of the challenges of sharing laptops in a school is that, you know, if you're using a lot of, you know, web-based, you know, Dropboxes and Google Docs, making sure that you're signed out is really important. And so it's one of the things that we've talked to teachers about, is just, you know, from a practical perspective, you know, time management at the end of a lesson, making sure that you give kids enough time to sign out, that you're kind of mindful of it, because, you know, if they're anxious to get to the next class and to not be late, you know, just shutting the laptop and leaving your account wide open is, you know, something that we've had some problems with, and so it's been a learning experience.
So TAP, I first met you at the Youth Data Science and Learning Summit, correct?
Correct.
In Berkeley, right?
Yes.
And could you talk a little bit about how data literacy comes into play here in using, you know, what your expertise in some of the work that you were describing just a few minutes ago?
Yeah, sure, absolutely. Yeah, I mean, I wanted to just take a second to piggyback on what they were saying, right, about phones, right? I mean, I think phones are a really interesting device, but typing on them is extremely frustrating, right? I mean, that's a very narrow channel in terms of authoring or creating data, you know? So we have to think about phones as like more robust and expansive devices than just hacking away like this at them. And so some of the things my group's been trying to do is to use like the other sensors on the phone, like namely the camera and the audio recorder, as a way of capturing more robust and more expansive notions of what data and experience might be. And so, you know, in the local ground project, for example, we use the mobile phone camera to take pictures of hand-drawn maps, and then those are digitized using some image processing tools that we built, and then they can be overlaid on various kinds of base layers and combined together and annotated and coded and so on. So I think we have to think about these phones not as they're typically used right now, but as more expansive devices, and also, you know, part of being an ecosystem with other devices like computers and servers and databases and so on. Yeah, I just wanted to say that. I thought, and the question about security and privacy is a very important one, particularly when you have this notion of data. And so I think, you know, having young people think of data creation as an intentional act, something you're doing on purpose with an end and with a goal in mind, is something very important to do, you know, as opposed to just being, you know, sources of data through their tacit interactions. They can actually intentionally create data for specific purposes and goals. And that gets to this question of data literacy. I think that's kind of the first step of data literacy, is what's your goal with the data? What do you want to do with the data? You know, and that a lot of, you know, for example, Bloomberg just doesn't collect data for no reason. You know, Bloomberg is a very good reason. to collect the data, and they collect the data for those reasons and towards those ends. Similarly, Facebook, Google, and other companies, they collect data with specific purposes in mind, specific goals in mind. And that's one of the first things we do, and from a data literacy perspective, when we work with young people, is to have them think about what's your goal, what's your end, what are you trying to do? Are you trying to design something? Are you trying to change some policy? Are you trying to understand a source of inequality or social tension within your communities? What's your goal? Because at the end of the day, a lot of these phenomena that we're talking about are well understood by young people in their everyday lives. It's not new to them to understand these sources and issues in their community. But what is new is this idea that they can use data to change those things. They can use data to affect either a policy or to design a new solution or to go speak truth to power. And so I think that's one of the first aspects of data literacy that I think is very important to me, is what's your goal with the data, and that goal driving what kind of data you collect, in what format, and what questions you answer with that data. Now, in the conventional notions of data literacy, we get very quickly into kind of statistics and doing various kinds of hypothesis testing and so on and so forth. I think that's very important. I think that's a very important set of skills and literacies to have. And I think that's also an important part of data literacy. But we often forget those kinds of very goal-oriented experiential reasons that we want to work with data that motivates all that other kind of understanding and knowing, in my experience. So yeah, did that answer your question?
Yes, you did.
Yeah.
Well, it's a start. A lot of the work that we've been doing most recently, along with the Northeast Big Data Hub, which is centered at Columbia University, is on big data literacy. We have a planning grant from the National Science Foundation, and we're continuing to pursue that work. And so we're very much at the New York Hall of Science thinking about these questions about what is big data literacy. And I don't know how many others in the room or on the panel, I know some of you, have been in these meetings. I know I've been to several where this is the conversation that's going on. What is big data literacy or data literacy? And it's a little bit the wheel continuing to be reinvented. And I see some heads nodding here. What we think it's time for is for there to be some coalescing around some agreed upon, a framework of how are we going to define what big data literacy is, and then of course how is it best applied, right? Through education of all kinds of ways, whether it be public health, informal, formal, whatever the particular populations we're working with. So, Clayton, what would a pathway look like?
So just
right?
well, that's a big question, right? That's what
Yeah,
we're here. But
right.
So I was just thinking, building off of what Tap was just talking about, and all three of the panelists here to my left seem to be primarily talking about individuals' personal data, right? The data that they want to collect either about themselves or about their communities or that kind of thing. Whereas the project that we're working on at NYU is much more use the data that already exists. There's already all of these administrative programs. They're collecting a lot of data for a lot of different reasons. What are better ways we can use that data that already exists to improve on that agency's mission, better serving different communities for different purposes? So I think there's a really important step of our own and everyone else's sort of data literacy about how they can use data, what data even is, whether it's multimedia formats or what have you. But there's another step also, which is how can we use big data, this huge amounts of data that's out there, to improve different social programs and see which ones actually work, right? So there's this, what are the outcomes? And I think Tap had a really good point of start with your question. And so here are, if we're going to treat this panel as a research project, it would be our question is, how do we improve sort of these marginalized communities' lives, I think is one step of that. And there's the education level, and there's also the existing programs and services out there that, talking to them, most of them think they can do better than they're doing now. Most of them have a sense of, we should be able to use all of this data that we have in a more efficient, more productive way. And then it's just sort of case by case how to actually do that. So that was a bit of a tangent from a question, but it was just interesting where my mind was going with their comments. One of the things that I think we talked about was, and sort of in that same vein, is working with a group of doctors or nurses or hospitals to get people, get patients to sign up and say, yes, you can use my data for a project, but then it's working with it, or an option would be working with Amy and different doctors at the hospital to say, okay, what's our research question? What data do we have access to? How can we do that? And then you could bring the local community in with, here's what our analysis said. Does this seem true to you? What are we missing? So get them engaged in that sort of what is the outcome of the analytics approach or the analytics project? What is the answer that the data is telling you? And does that seem to be true on the ground? And then iterate.
So what would that look like? I mean, if you were going to collaborate, I'm looking at Amy, on would your patients, how would they be willing to have their data be made available for research?
I think they would, if we explained it to them. So one of the most lovely things about working with the patients and families that I have is there still really is a tremendous amount of trust in the doctor-patient relationship in a way that I don't think necessarily is pervasive throughout society today. So I think that, if we explain to the patients that why we're trying to collect the data and what the goal of it is, then I think that they would be willing to do it. I would have to say, I think very few of my patients would have kind of privacy concerns in the way that we think of privacy. Most of them would have more concerns around kind of the governmental involvement and, a lot of legitimate fear at this point of kind of signing up for anything that where the government is going to know where they are or tracking them or things like that. But if it was kind of a depersonalized data set, I think that they would welcome the opportunity to participate in something that, while it being probably a bit of a stretch for them to kind of comprehend exactly where we might be going with it.
Trust is a huge issue. If any of you were in the panel moderated by Noel Hidalgo this morning, that was one of the things he said, and I believe the word he said was years, that it was years of building up trust between city agencies, the community board, the community, and data scientists, right? Tap, I don't know if in some of your projects, if that's been an issue when you've been working with different groups out in Berkeley or maybe more recent work.
Yeah, well, absolutely. I would say even beyond trust, is there's just a great deal of skepticism out there when you work with certain communities about the role of data in their lives and whether or not things will ever change. Like, getting to this question of public data, we did a project in East Oakland once, which had young people ground truthing a data set that they had gotten from the county. It was a data set about grocery stores in their communities, and they had gone out and done their own survey, and they had found out that some of the data actually wasn't accurate, at least as per their categorization of those same locations. And so they were able to contest this existing representation using their own data, and that showed one interaction they had with public authorities. In some sense it was somewhat adversarial. But there was also this big question of why are we the ones doing this work? Like, why are we being asked to correct these existing data sets? This should be the county's job, the city's job, and they should be doing a good job of it. Why are we put in this position of having to be the ones to carry our own data and to make our own points with it when this is the jobs of these authorities? Similarly, we had done a project with the BART public transportation system in the Bay Area, where young people had taken air quality sensors and done a survey of air quality across the Bay Area, and in particular at BART stations. And they came up with a finding that showed unhealthy air quality at some of the stations. And again, trust takes a long time to build up, but especially when these findings are discounted by public authorities. So they went and made a presentation to BART, and the first presentation, they're like, no, your sensors must be wrong, was the response. And these young people, they had great pedagogical support, they had great facilitators, not us, we had just built the tools. And so they had gone back and they kept working, and they published an academic paper actually on their work, and then they went back and talked to BART again, and they got some more momentum. But it's really hard, it's for young people especially to have agency in these kinds of conversations. And that's what we found, that one toehold for data is that it gives kind of more leverage for young people in describing their own lived reality and their experience, allows them to build kind of internal consensus around certain shared observations and issues. And with that internal consensus, again, through the form of data and shared databases, it gives them more confidence and more voice and more ability to negotiate within these kinds of contested realms. So yeah, I think trust is one element, but I think some of these things, it's actually they're actually having it's a kind of struggle, and they see themselves on one side, and they see public authorities on the other, and whether rightfully or not, that's how they perceive it.
The project, Anthony, that you mentioned, Mobile City Science, this was a project that the PIs from University of Washington out in Seattle, Mobile City Science, and we worked with a great group of a dozen of your students, and their final presentations were, they, after doing these walks and asset mapping, came up with several gaps or problems that they thought, all of which they had personal connections to, right. And they gave these very moving, incredible presentations to at NISI to an audience. If I can just tell, one story was Jose's story about the Friendship Plaza, young man from Ecuador, as a lot of Corona residents are from. He wanted to turn Corona Plaza into what he called a Friendship Plaza, and we could never understand, for shy people, right? He kept saying for shy people. Now, Jose is the opposite of shy. He talks to anybody. He's always the kid with the hand up in the air, right? During his presentation, he told this story of why, which was when he had just come to the US, didn't speak any English. He didn't understand how to get a ticket on the bus or a pass or whatever, what transfer, and somebody made fun of him. Yeah. And so this was kind of a reaction to that, right? Very moving. What was a little, and Tap, you sort of touched on this, what was a little frustrating, I think, was there wasn't anywhere for them to then go with their ideas about bike lanes, trash, Friendship Plaza,
bus tour.
The bus tour, right, and the place for teenagers to hang out. I mean, all of these are actual, real problems, right, that they identified, and they had data to back them up, right? And so I don't know if those particular students spoke to you about this, or if you can see ways to make connections for them in this pathway. So
the project was, for me, kind of referring back to that trust building activity, almost like a proof of concept that you can incorporate this kind of work into the existing pedagogy of the school. And so the person who I think is one of the great audiences for this is actually the 12th grade participation in government teacher, because it was a university project. It was a little bit open-ended when we started it. So kids are going to go into the community and identify a problem, and typically that ends up becoming something about recycling or something that's really apparent. And so for me, it was really heartening to see the variety and sort of detail of proposals that students came up with, and where the impetus for those ideas came from. So some of them were from the walk, some of them were from interviews, some of them were from looking at data sets. And so the idea that you can sort of turn students loose into this kind of environment and they can indeed come up with something, to me, feels like if you could build that sensibility into a class where, if the idea of a participation in government class is for students to participate in government, the next logical step would be to find the venue where that kind of conversation would be taking place. So is it a community board? Is it an MTA hearing? Is it parks budgeting meeting? One of those settings, to me, would be the next logical step for it. And so I think that's kind of the direction we'd like to take it next. Great. There are 10 minutes or so left. I'm wondering if are there questions? People have questions?
So the question is that you you mentioned about the skepticism that people have about collecting data and then their data being collected, and why do they have to do the work. Is there also skepticism from the people who actually decide on the policies from that data? And let's say if you have the numbers and if you show them, and if they just they're not convinced about it, or they're skeptical about the study. So how do you deal with this? How do you convince someone that this data is actually what it is, and that there needs to be an action taken? If that makes sense.
Yeah, everyone's looking at me. I don't know. That's a very hard question. You know, like, so when one of the examples that we did, we had young people participating similarly to what was described in Mobile City Science in an urban planning project, and the young people wanted to have a graffiti wall in their park. They were part. It was actually a redevelopment project was happening, and there were community meetings, and they went and participated, and they showed their presentation. But under no circumstances was the town manager going to allow a graffiti wall in that particular park, no matter what data was available. So, so yeah, I think it's a very difficult question. You know, I think a lot of times before the data is even collected, the decisions have been made. You know, and the data is just an excuse to make the decisions that have already been made. And so, you know, how do you engage? And I think you have to think about this as a much longer-term process of building solidarity and momentum and behind various kinds of initiatives and projects. And so I think it has to be situated not only in a public deliberation process, which is great. I think having young people participate in a public deliberation project is a very important lesson in civics, and how to use data in those kinds of fora is a very important lesson in data. But independent of that, I think it also has to be situated within existing community initiatives, community-based groups, nonprofits, advocacy groups. And that's what sustains these ideas over time. I think one of the most frustrating aspects of the projects that I've done in this realm is that kids graduate. And after kids graduate, those ideas are gone, and their lives just go off in a different direction that had nothing to do with their ideas or their data. And they think back on those moments in their lives as like really hopeful and inspiring moments where they had an idea or they had a vision and they wanted to work towards it. But as soon as they graduate, they're off on some other trajectory that has very little to do with that. So I think looking for existing community-based initiatives where young people could connect their ideas and their skills to is probably the best idea I have.
And I think I have a slightly different perspective, a complementary, I hope, sort of perspective to that of that over time piece. One way to sort of help build trust in what you're doing is transparency and repeatability, I think. So if you can prove sort of how your data was collected by showing somebody how it's actually done, then show them what the analysis actually was that you did, and be able to take them through that entire process from data generation through results interpretation, then it's you have a much stronger base to stand on in terms of convincing somebody that you're actually not just making up your answer because you feel like it.
I mean, just one example that came to mind is maybe one level up from sort of student-led inquiry is this idea of teacher-led inquiry. And so we use instructional teams at our school where we have a group of teachers who work with the same smaller set of students in a classroom setting. So they'll see those same kids in the same class configuration throughout the day. It's a history, math, English, and science teacher. And the idea is that it creates opportunities for collaboration on not just how they cover content in an interdisciplinary way, but also maybe on some of the strategies they use. And so it's creating an opportunity where that can happen. Our school last year implemented a reading project because our theory was that if kids are reading more, then it would translate to higher levels of attainment on their ability to produce language in English. And so we were really working to open up access to, text sources and professional development for teachers, because it couldn't just be a problem of the English teachers to do this. Kids need to be reading in history, math, English, and science all at the same time. And so it was a matter of creating an opportunity where the teachers could work together and to hopefully bootstrap themselves up on some of the findings, that they're not going to be asking the same question at the beginning of this year that we were asking at the beginning of last year about which of these 3 or 4 reading programs that the kids are working on is or isn't having an impact and is worth the time and effort that we're putting into it. So that idea of ownership and transparency, I think, was part of that as well.
I think it's a very good. Teachers provide a lot of continuity. Teachers who can build on curriculum and ideas and projects year on year. I think another opportunity, is linking formal and informal spaces. So in one case where we had a class that we explored some of these ideas with, we converted that class then to a summer internship and an after-school club, and so we were able to work with the same group of kids for like 3 years. And that, none of those projects happened, but those kids actually got to work on a lot of different projects that helped them become a lot more empowered, I guess, with data.
The question over there, yeah.
We're involved in a project that's a crowdsourcing public health social good project. Actually, the poster is downstairs, called iRescue. And during our proof of concept, we held a number of gamification challenges and were quite surprised to see a classroom of 11-year-old kids crowdsourcing public access to defibrillators at a higher rate than any other group in the world did. And it really highlighted that kids with a smartphone only, and some just had a piece of paper and a camera, and emailed results, really can not only actively participate in a project that's a social good project that they can do with the tools they have, but really actually make a difference and save lives. So we've found that a great resource and hadn't anticipated 11-year-old kids. So do take a look at the poster downstairs in the 5 p.m. break. And I think there really is enormous potential for engaging young children in life cycle projects. They took their parents with them, and their parents were being educated by the kids in something that's an important public health issue that's there to save lives. So I think that we really need to make sure we do reach out to young kids with very basic tools that can make a really big difference. So I commend you on the amazing work you're doing. And, the whole citizen science movement has just exploded overnight. And, 11-year-old kids are very competent to participate in citizen science in a real manner, not just as a game. So thank you.
How many people here have heard of Link NYC? Most, right? Just the other day, a recent staff hire at NYSI who grew up in Corona and has a master's degree. I asked her if there were any Link kiosks in her neighborhood, and she didn't know what I was talking about. And Corona, I think, is right there. I think we can see it from here. I was trying to see. And that, in a nutshell, right, that is the gap we're talking about with smart cities technology, right, that we're trying to cross with the work of all of you and all of you. There was another question back here.
Hi, particularly for communities like Elmhurst, which are as culturally diverse as you had mentioned, are there any considerations or controls that you need to implement to potentially account for cultural biases in the baseline data that you're looking at?
So one of the things that we try to do is to have a staff whose diversity reflects the community of students that we serve. It's imperfect because there are licensing requirements and there are certain communities who are not as well represented in the available teacher pool or staff pool. So we've tried to be creative by staffing other positions like, parent coordinator or, community associates, so that we're bringing in the perspectives of people from a broad range of experiences. That serves a very practical purpose, because if you have a community that speaks this many different languages, then having the staff with the broadest possible linguistic skill set available to you makes it possible to have that kind of meaningful conversation with the family. But I think it also provides an opportunity for perspectives of people with different experiences to come in. And we've tried to also have a more horizontal school level organization through a coordinating council and committee structure to help bring those classroom experiences and student experiences closer to the decision-making table.
As a very critical person, I like to teach young people to look at all data sets as biased. It's just the source of it.
So I was going to say, there's bias in all data. It's a matter of framing your question appropriately and interpreting the results such that you try to limit those biases as much as possible.
Well, we've got 25 seconds left. Anybody have a 1 or 2 word question? No? Okay. Well, thank you, panelists. Great discussion.